What is going on, everyone? It's your boy here, Organically David. Welcome back to my channel. Super excited here. I'm going live because, hey, what's better than going live? Because I want to get you the raw emotion, the raw feelings of everything that I'm going to talk about. And I wanted to really, I'm so excited about today's topic because it is just it's extremely important. So I want to make sure I get all my words together, and I want to make sure this is not convoluted and it all makes sense. We're talking about cancer here, and as you've seen from the title and the description, we're talking about cancer and how my wife was able to get through cancer with uh, minimal, very, very minimal side effects. I mean, when I talk about minimal side effects, and there was one part where she didn't have any side effects at all. And I'm super excited to share that with you. Everything that's organic, everything that's holistic, I want to share with you today. I'm not sure, just based off of how long this video is, if I'm going to break it up into two parts, because I want to give you some context first, and for all of it to make sense at the end. So without further ado, let's go ahead and get started. Again, I'm already Organically David. Thank you for joining me on my journey as I strive to live organically in every way. And it is my goal, my duty to help you do the same. As you can see, from the description, I'm at 18 years now of living this organic life, just studying, researching, and experimenting with myself and others. And I've been able to coach many people through their own health journeys, as well as their mental health journeys, because I'm talking about being authentic and being organic and authentic just from the food and health perspective, but also from your mental health, getting your mind right. And that's what we're going to talk about today. So I want to go back a little bit to 2021. My wife and I, we decided that we wanted to complete our family. We already had our son, and everything was looking good. Everything was great. We were excited when she got pregnant, and I believe it was October, November timeframe. She got pregnant, and we made it through the holidays. Everything is good. So January comes around. We go to, I believe it was our first appointment. Maybe it was our second, but I think somewhere around. It was very early on, obviously. And we got the ultrasound. Everything looks great there from the ultrasound. And then because we are 35, over 35, we're considered geriatric in pregnancy. Those of you who had children at a later age, if you're at 35 or older, you're considered geriatric. So that means that you then have to go to the antenatal clinic. And an antenatal clinic is also considered, you may hear called the high risk clinic as well. And those are for people who are over 35 or those who have any other high risk conditions. So high blood pressure, diabetes, obesity, or if you have triplets or something like that, anything that needs a little more focus on. And if you're in our condition or our situation, we were over 35. So that means that we go in just like everybody else. And there is certain risk factors for being older when you get pregnant. And one of the risk factors are developmental issues. The baby developing and the way that they should be. So we went in after our ultrasound. Again, everything looked great. And we're sitting there going through the process. And then we go to as another ultrasound, which is a little more detailed. They do all the measurements. They look at the baby closer. It's basically a more powerful ultrasound. So we're sitting there, ladies laughing and joking, the technicians laughing and joking with us. And we're just talking about the baby, talking about our son, who's growing bigger and bigger every day, has opinions now. But we're sitting there, and then all of a sudden she just goes quiet. And I noticed that she's measuring the NT, which is the nuchal fold, or has something to do with that area of the nuchal fold. And she's taking the measurements over and over again. I'm like, what the heck is she doing? She keeps taking that measurement over and over again. And while I'm sitting there, I pull up Dr. Google and see what the nuchal folds or what that even is. And that's the measurement of the fluid between the skin on the back of the neck. And the reason why they measure that is because that can be an indicator for Down syndrome or some other issue. And so she's checking it over and over again. I'm seeing these different numbers, and what I see on Google is supposed to be between 1 and 3, or maybe it's 3 or less. 3 is considered 3 millimeters is considered the upper level of what's considered high of normal. Yeah, sorry, the higher level of normal. So the numbers I'm looking up, I look up and I see 7, 8, 9, and sometimes I saw even like 11. I'm seeing these really high numbers. So now I'm starting to get concerned. So I decide, you know what, I'm just going to get off of Google and just let her do her work. But then it's taking longer at this point. And I'm remembering it for my son. My son took maybe 10, 15 minutes for the entire appointment, and everything looked good and everything was stamped and approved. So I decided, let me look to see what my son was at this time frame. And I think his came out to be like 1.2. So at this point, I'm starting to get a little more concerned because she's quiet. She's not really responding. And then she goes and gets the doctor. She says, I got to go get the doctor. The doctor comes in. He pulls the Band-Aid right off and says, there appears to be that there's something wrong with the baby. I'm going to go ahead and check. So he puts the probe on, takes maybe like 10, 15 seconds. And he says, okay. And says, you can get dressed. Told my wife she can get dressed and come into the office. We feel like at this point we're in the principal's office, we call it, because we feel like we did something wrong, got in trouble. So we go in to the office, we sit down, he shows us some images, and he says, basically, long story short, the baby doesn't look like it's going to thrive and survive too much longer. 7%, based off of the measurements, we have a 7% survival rate. So this hit us heavy at that point, obviously, because we were super excited to have our baby, and just, it's your child, right? It's your child. So we make it through that, and they tell us we got to wait a few weeks just to see, maybe it might resolve itself. He's seen it before, but it doesn't look good. But let's just pray and hope that we'll make it through it. Some time goes by, a few weeks go by, we go back in. As soon as the technician puts the probe on to my wife, I'm looking for the heart to see if the heart is beating, and I immediately see the heart's not beating. At that point, I just knew. She didn't even have to confirm it. I knew at that point. We just told the technician, because she was same way, friendly, bubbly, ready to go. Let's just see the baby, all that kind of stuff. I don't think she was really aware of why we were in there at that particular time, but I just saw her face just drop. But she couldn't say it. They can't say anything. It has to be the doctor who says it, confirms it. So doctor comes in, or I think it was a nurse practitioner that came in and told us, hey, baby's no longer with us. And I don't know if it hit us heavy at that moment. We walked out, we saw the doctor who told us at the beginning, and he hugged us and said, I'm sorry. All of the niceties that they say, I really appreciated his approach, that doctor's approach, even the nurses and everyone there, their approach. It felt like they cared. They felt like they were involved in more. It was more we were more than just patients to them. They made us feel like they were actually hurt and sad and for us. There was the empathy there. And so we meet with the genetic specialist and all that stuff, and we leave. Then we were supposed to we had to get a procedure done to get the body out, obviously, because a baby's body can't stay because it's no longer with us. So they go, which is a whole nother discussion about that and the laws and stuff like that. But so we go get the procedure done. They remove the baby, send the baby's uh, body to labs for labs and all that stuff. And we don't find out until a year later that something happened with the lab. They received it, but then they lost it. I don't think they lost it, but I think that the doctor, I'm not trying not to cuss here, it was a different doctor. It was our original doctor who really, really treated us like we were just another number, like just a number. She didn't care about anything. She didn't care. She wouldn't call us back. It was hard to contact her. Matter of fact, one time I called her, left a message. She called me back immediately. And I don't know if she was just trying to avoid me, but then she calls me and she has kind of a stink attitude and says, "Oh, I'm trying to do something else. I'll call you back." Never calls me back, even sends us a MyChart message maybe a few days later after we contacted another doctor who was in our office. That's when all of a sudden, "Oh, I got your husband's email." But I don't want to think too much about her because I have some choice words that will get me banned on YouTube if I continue to talk too much longer about this woman. Thankfully, she's no longer at that facility. Hopefully, she's doing something totally different now because she's just, people are just another number to her. But in that process, when she was going for a follow-up appointment, she met with the same woman and she said, "I noticed that there's a lump in my breast and I'd like to get imaging." She says, "No, you're young. You're fine. It's probably just your milk coming in. No big deal, right?" You don't want anything to be wrong, right? So you don't want to just keep pushing. And so we said, okay. We left, and I think maybe a little bit, just it wasn't much longer before my wife says, I better get this checked out. It wasn't even maybe 2 weeks later because it just didn't sit right. At least I need peace of mind. So we went back to the doctor who delivered our son, who's big time now. So she wasn't able to help us through this pregnancy, but she met with her. She asked for imaging. She said the same thing. The doctor said the same thing. She said, "I don't think there's anything wrong here, but let's just go get imaging just in case." Because the majority of the time, there's nothing. There's no issue. It's just a lump. Sometimes it's fibrous tissue, whatever. It's just something totally different that's not cancerous. So she goes to get imaging, it goes immediately. Maybe it's like a few days later, she gets imaging. And I believe it was the mammogram. She got the mammogram. The doctor that was there said, "Looks a little concerning. Let's go ahead and get I believe it's called the sonogram at that point. Sonogram, ultrasound, I don't know which one it is, but it's an additional imaging." She takes a look there. They look and read the results while she's there. Says, "Yeah, it definitely looks concerning. Let's send you for a biopsy." She goes, gets a biopsy immediately. And all this all happening on the same day. So, which is unheard of because a lot of times they send you home, then you got to go back, and then you got to make another appointment, and you got to go back, then you got to make another appointment. But and we drove around, we had to go to different places. So, because we wanted to know, we needed to get imaging. So my wife went to these different places. And so she got the biopsy done. She got the biopsy and it came back a few days later because my wife's personality, she's very friendly, very, she gets along with everyone. So she got along with all the nursing staff and everyone, and she has a great personality. And that definitely helps when you're navigating anything difficult, especially anytime you're dealing with other people. Start with positivity, respect, professionalism, and that would take you a long way. That's just a side note. And so she was able to get her results rushed. We got her all of this stuff done within like a week, and then we got the results that following week. I believe it was like a Monday or Tuesday. We're in April of 2022 at this point. So April 4th, 2022. My wife calls me. I'm driving to work at this point. I'm driving, and it's raining hard, and I know that these results are coming back. So every time she calls me, I'm like, my heart is beating really hard at this point. And she calls me and she says, I have breast cancer. And I had to pause because we just lost our baby not even a month ago. And now I'm having to process my wife who's got breast cancer now. Like, I'm knocking on heaven's door. Is there somebody else up there that I can talk to? Because something ain't right. Something's not right. What is going on? It just blows my mind. And so I just turn around. I can't go to work at this point. So I turn around and go back home. I make it home, we talk, and we just process, and we're trying to understand, and it's just a lot of emotions, and you just don't know, because cancer just has this stigma with it, just for obvious reasons, because you don't know what's going to happen. You don't know what's going to happen. Am I going to die? Am my son going to be motherless? Am I going to lose my wife? It's just so much stuff you're thinking about now. And then you just start thinking about treatment, chemo. Is she going to be in the hospital, throwing up all over, falling out, all kinds of stuff? And so that leads me into my first tip, and that's, we don't know what to do, you act. I mean, that's all I can tell you. The first thing you do is act. You may not know exactly which method, where to start, where to go, what process, or what to do. But I would tell you, just act. Do what the next best thing would be, and that's to take action. And you'll process the emotions while you're going through it. So we decided, let's get it. So they set an appointment with a doctor, and I believe it was a month later. I think we were April 4th, and I don't think it was longer than that. Actually, it was April 4th when we got the diagnosis. The nurse called her, and matter of fact, the nurse wasn't necessarily supposed to call her. She said, I'm not really supposed to call you, but I got your results. Is breast cancer, and I want to get you on the schedule for a doctor who is the best in this area. Only thing is, he doesn't have any appointments until, I think it was pretty far out. I think I want to say it was like 2 months. I think it was somewhere in June. That's just to get assessed. So we said, let's keep that appointment, but I'm not sure if let's just keep that appointment. Let's get second, third, fourth opinions. So we met with 5 surgeons, because it really was the surgeon, I think, who was setting things off. So we ended up meeting with the surgeon of a facility we didn't really necessarily like, but we kind of had some connections with an organization that doctor was involved in. So kind of knew her through a person of another person kind of type of deal. And so we met with her. She immediately took genetic testing and sent her for a ton of scans. And she got the PET scan. She got genetic testing, the PET scan, the breast MRI, and I believe they also wanted to do one of those, another sonogram or ultrasound, whatever those are called, and maybe an X-ray. It was a lot. It was a lot of scans, a lot of scans, a lot of tests. And I'm actually was grateful for that. So while she was getting all those scans and tests and all that stuff, we met actually with another another health system who had a multidisciplinary approach to it. where we met with their surgeon, their oncologist, the radiation, and all of those people. That was a lot. If you ever go to one of those appointments, that's a lot. It took maybe like 2 hours, and where we met with the entire team, and everyone wants to examine, everyone wants to check, everyone has, especially if you're in a training hospital, everyone wants to bring in the people that they're training, bringing them in and check. And at this point, it's just, it can be overwhelming because it's so much, and everybody wants to explain uh, the process over and over and over and over again. So you hear it, so it can be overwhelming. So just be prepared for that. And so then they saw we got the PET scan, MRI, and all that kind of stuff all together, but they also did the biopsy for the lymph nodes. So they got all of that scanned, everything. At that appointment, they started to stage it. So at that point, it was they were between stage 2A. It was like a stage 1B to 2A at that point, but they said because looked like one lymph node was involved, they put it in as stage 2A. So the size determined the stage, and where it is and all that kind of stuff determines the staging, and there's other characteristics there. So they biopsy the lymph node. And when they're biopsying an area that they're suspicious, or if they see that it's cancerous, meets certain characteristics, they'll inject a tracer into those areas. So my wife had 2 tracers put in her breast, and then as well as one in the lymph nodes. So they got, everything's been biopsied, been scanned, and everything is set and good. And so then for oncology, we met with another system, Johns Hopkins, is where we ended up doing our chemotherapy. So at this point, before we get into her treatment plan, so she was diagnosed with stage 2B breast cancer. Yes, it was stage 2B breast cancer, ductal carcinoma, HER2 negative, estrogen positive, one lymph node involved, and it wasn't spread out anywhere else. It was just local to the breast, and I guess they call it local or regional or something to that effect. But anyway, it was just only in her breast and one lymph node. So she then we then decided to do chemo, an neoadjunctive approach, and that is when you do chemo first, then surgery, then radiation. Studies have shown that approach, long term, you're less likely to have a reoccurrence if you follow it that way. So we decided to do chemo at Johns Hopkins. We met with a great, spectacular doctor who was actually really difficult to get on her books because she is the head of the entire department. But again, like I was saying, my wife's personality, she was able to get into all these places, navigate through there by being friendly and polite, and getting along well with people. And I keep harping on that because I see a lot of people in these situations who are very stressed out, and they get in and they're very angry, or let me tell you, if you're just anything in life, you should know that anywhere in life, if you are friendly and polite, respectful, and people will push a little harder for you. It won't change your medical care, but it may give you a little more of the niceties. You may get the extra blankets. They may find the schedule for you that wasn't there originally. They may be able to move some things, or they'll remember you when they're making the schedule. Oh, she likes early appointments, so let me make sure I look way ahead and try to get her on the schedule. And being nice to everyone. I say being nice and respectful to the person who's greeting you as you come into the door, to the janitor, to the nurses, to doctors, to everyone. Being respectful, I'll tell you, will go an extremely long way, because you never know how that you're impacting to other people, how people remember you and view you, how that's going to change your care altogether, your entire experience, I should say, altogether. And from parking attendants, everyone, I'm just telling you, it definitely helped in this entire process. So chemo, we started, I know I'm all organic and holistic. So a lot of times we will say, don't do chemo, or I don't know about chemo and all this stuff. I would say stay away from anyone telling you anything extreme. We've had even surgeons even tell us extreme things like don't do chemo. My wife, her breast cancer type was estrogen positive. So the studies have shown that if you're hormone positive breast cancer, or any type of hormone positive cancer, generally is not going to respond as well as something that's not hormone positive. And so we had a surgeon tell us, I wouldn't do chemo. Just, I can cut it out. I can get it out. Don't worry about that. I'll leave the lymph nodes alone. I'll just cut out the oh no, he's going to take out just the one lymph node, do the lumpectomy, and then let radiation kill off anything else that might be there. And I'm like, I don't like that approach, versus someone else who is like, you know what, I'm just going to take out all the lymph nodes and do a double mastectomy. And either extreme, I needed somebody who was in the middle, and I needed someone who believed in our approach, because I am all about authentic, organic, holistic healing. But also, I believe that it can work in tandem or unified with conventional treatment, and they can work hand in hand together. We just got to figure out the process. And so I kind of stayed away from anyone who, even in the naturopathic world, they may say, don't do chemo, don't do this, that, just take this, take that, and you'll be perfectly fine. I'm not, let's just assess the situation first and get as much information as we can to allow us to make a decision with our doctors. And that's what I'm telling you as well. At no point am I telling you, don't listen to what your doctor says. Don't do this, don't do that. Just follow up with your doctor. That's the main thing. Follow up with your doctor and get as much information as you can on either side. What about this treatment? What about this medication? What about that? And then making the best decision. And if your doctor doesn't believe in what you want to do, then you can find another doctor and decide if that's what I want to do. So you can make the best decision for yourself with their advice, because this is your health, your body. So you make the best decision for yourself. So we decided on a neoadjunctive approach. So we did chemotherapy first. Chemo was 4 rounds, adriamycin, Cytoxan. Or you may hear about another name called doxorubicin. I believe adriamycin, the name adriamycin, has been recently discontinued. I believe the drug is still being used, but the name is being discontinued, or there's generic versions of that are being given at this point because of the heart conditions. They're seeing heart inflammation in patients. Because it's a very strong and toxic chemotherapy. And it does its job, though. It definitely kills cancer. It just, unfortunately, does damage as well to the rest of the body in certain areas. But I don't want to scare you with that there, but that's just a matter of fact. And I'm going to talk about how you can avoid the damage or lessen the damage altogether through some natural stuff. So adriamycin, Cytoxan, which are 2 different drugs, but they give them back to back. And then, so that was 4 rounds. She did standard of care. So it was 4 rounds of adriamycin, Cytoxan once every 2 weeks. And then right after that, she did uh, 12 rounds of Taxol, and that was once a week for 12 weeks. Right after that, she had a lumpectomy, reduction in lymph with removal of 6 lymph nodes. And then after that, she did proton radiation therapy. Proton therapy is relatively new and really expensive. So it may be a little bit of a fight with your insurance company. If you have insurance, it may be a little bit of a fight with your insurance company to get proton therapy. They say that proton therapy and regular radiation is close, but proton therapy is just a little stronger. And so we figured, hey, she's young, we're young, and so we have a lot of life to live, so let's throw everything at it as we can. And so that's what we decided to do. So and we are in, this is August, we've completed treatment was completed February. Active treatment was completed in February. From February and for the next, I guess, 4.5 years, she's going to have to take a monthly injection of, I don't know the name of it, but it's an ovary suppressant. So basically to suppress the ovaries, which reduces the amount of estrogen, as well as, I believe it's called anastrozole. She has to take that for the next 5 years. I'm not sure how long she has to take the ovary suppressor, but I know for the estrozole, she has to take that for 5 years. I believe it's called estrozole, but it's a hormone blocker as well. That's specific to the type that feeds breast cancer for her specific type of breast cancer. She was declared or considered cancer-free after her surgery. And that's what I'm so excited to talk about, is how she was able to get there. And she had a complete response to chemo. And that everyone was super excited about it. All the doctors are like, wow, you had a complete response. How did you have a complete response to chemo? Because she already had a great prognosis altogether. But we stacked on things that caused her prognosis to be even better. So her recurrence risk, her survival rate just kept going up and up and up, because at the very beginning, it was like 91% survival rate. And then she had a complete response to chemo, which then put her at like a 96% survival rate. And then with the ovary suppressant and the estrozole or whatever, she's at like 99% or something to the effect. The oncologist, many of the oncologists that we met with multiple doctors who we met with along the way. They all are talking cure. We're going to cure this. And I never knew that was a cure. And cancer to me was never, I can never associate the two. I always thought you just treated it and then that's just what it was. And then maybe you survive, but never cure was never on my top of my mind. But that's what they were saying, because it was weird when we were going through this entire process, and we met with a lot of people. And I'm telling you, a lot of people, a lot of doctors, a lot of students, and everybody wants to touch, feel, look at. And I appreciated the one doctor who actually came in and says, I know this is a lot. Would you mind if I do an examination, because I'm learning? And we appreciated that doctor, because he was able to really think about, there's a person connected to this. It's just, these are not just breasts. There's a person connected to these, right? And I know it was, for me as a man, as a husband, it was kind of difficult at first to see like all of these people, everybody wants to touch and look at and feel. And then the hard part, which I'll talk about in another video, for me, was not going the opposite extreme, because it started to become like I I was just so used to it that it just started to um, desensitize me in a bit. Um, so I'm gonna make a whole another video about desensitizing to that. Uh, but I want to stick on this chemo subject though. So in her process, so she did chemo first, adriamycin cytoxin, once every 2 weeks, and that adriamycin is extremely um, extremely. Uh, I'm going to select my words carefully, because I know toxic, and poison, and all those things come up in your head, and you're like, I don't want to do it. Never mind. Uh, but I just want to kind of prep you if that's where you got to go. In adriamycin specifically, they come in, they have all the gown, they're covering themselves up or whatever, and you're like, you're about to inject me with this stuff. You're about to inject me with this stuff that you got all this gear to cover you, to protect you from it. But that's just because they're doing it all day, and if they are exposed to a spill or something, then obviously that's going to be harmful to them personally. So um, I watched them come in with these vials or these syringes of this red stuff, and they call it, the nicknames, the Red Devil, and we like to call it the blood of Jesus, but because it's red, it goes through your body, and it flushes out, and everything that's coming out is red as well for about 2 days. Now I would tell you that just as a tip, get the port. They'll put the port in you. It's on your chest. It goes down. There's a little, I guess, I don't know what material is made out of. I don't know if it's silicone or whatever it's made out of, but it goes down into your main artery in your heart. I think it goes through your jugular vein. I'm not 100% sure, so don't quote me on that, but I believe it goes through a very, very large vein into your artery in your heart. And that's where they do all your injections and your infusions. And I'll tell you, if you're nervous about the port, please just get it. You will have a scar. You will have a scar. You can work with your doctor, whoever puts it in, on placement. Maybe it could be a little bit lower, down, wherever, on your bra strap, whatever it is, or if you ever wear anything low cut, they recommend you wearing that to that appointment, so that way they can kind of angle it in a way that it'll at least be covered up, so you can wear something low cut, for life, if you care about that. Some people they don't care, and they're like, whatever, just put it whatever. But that will save your veins. I'm telling you that, especially with adriamycin or any type of chemo. But you got to think about it. If you're going to get 12 rounds of Taxol and 4 rounds of adriamycin, so at that point, that means if you're getting it through your vein, you got to go in 16 times just to have it injected into your veins, and it's going up real slow. And so as it's going up, it's doing damage. And they're saying that it could do so much damage to your vein that you may not even be able to use that vein ever again for any reason. I mean, blood would still flow, obviously, but you would no longer be able to access it for giving blood, getting fluids or whatever. Any type of medication through that, it'll do damage to it long term. So, and think about, if you're getting 16 times plus, you're also having to get labs every time you get chemo. Right before you get chemo, you got to get your labs done to make sure your white blood cell count and all the other CBCs and all that stuff checked. You got so you got to get your vein accessed at 32 times at least. And I don't know if you've ever given blood or had to take an IV or something like that, and the person is not that great at doing it. thinking about having to do that 32 times, just, that sounds horrible to me. So if you get the port, all they do, they access it the same. I mean, not the same way, but it's not through a vein. It's through your skin superficially. And there's a little device, and basically the little small needle goes into the device, and you get just little prick each time versus having to have your vein access every single time. I'd recommend it if you can get the port. Please get it. Don't mess up your veins. And then it's just so much easier. Your arms are free. If you want to get up and walk around or whatever while you're getting the infusion, you can just hold it without having to feel like it hurts or whatever. So it's just better to get the port. And so let me see, how am I doing on time here? I'm at 40 minutes on time. So I want to break this up just so it's not excessively long. I will break it up. I just wanted to kind of let the groundwork and give you context of where we started to where we got through on this particular journey. And again, my wife had stage 2B breast cancer, ductal carcinoma, HER2 negative, estrogen positive. She was negative for any of the BRCA genes or anything like that. And she had 4 rounds of adriamycin cytoxin, Taxol, 12 rounds, and then a lumpectomy lift with a removal of 6 lymph nodes. And she's in proton therapy, full 28, and then like 7 or so of the boosters after that. So she's cancer free, and she was able to avoid major side effects. And that's what my next video is going to be about. How she was able to navigate that, how I was able to coach her through it, to minimize side effects, and also how I was affected by it from my own health. Sure, I have been living this organic life and making sure that I was living holistically and taking herbs and all this stuff, health-wise. But as far as my weight goes, I lost 90 pounds in this journey as well, as I was supporting her through it. So I want to talk about that on the next one. So thank you again for joining me on my journey as I strive to live organically and authentically in every single way. It's my goal, my duty to share with you the 18 years of experience that I have in this world of organic living. Please follow me on Instagram at Organically David. Check out the journey of my wife as I talk about as she was going through that process. I know that I experienced a lot of mental health challenges throughout the process, and as the person who was going through it, but my wife was actually going through it, meaning she had to not only mentally process it, but she had to physically process the loss of the baby and the breast cancer and the infusions and all that stuff. She had to be the one to go through that. And so she has an amazing story that please check her out on Instagram as well as YouTube at Honestly Candace on all platforms. She has an amazing story, and she's able to help you in finding your voice, helping you become resilient. And I know no one wants to be resilient because by definition of the word, it means you have to go through something. But if we all just keep waking up, we're going to go through something. So it's better to be equipped with the tools and the tips and the tricks to help you make it through those challenging situations, because we all are going to go through something. We're just going to go through something. That's just life. And so we want to do the best we can. So for me, it's about prevention, being a proactive approach. And my wife will be able to talk to you about what she did after she's been able to go through these processes, or what she was doing while she was going through that process. And she also can share with you back in 2008 when she was diagnosed with MS. So she's had a lot. And to be where she is now, asymptomatic from MS, she made it through the baby loss, and on top of that, making it through breast cancer, and now being cancer free and being at the top of her game when it comes to just this mental health space. Definitely check it out. Again, Honestly Candace. And then please don't forget to subscribe to my channel, like this video, and hit that notification bell. And let's just talk about all things organic. And if there's anything else you want to talk about while you're thinking about it, please comment down below. Anything else could be something totally just not related to cancer. It could be anything about organic or authentic or whatever it is that you want to talk about. Please comment down below. I appreciate you guys, and be safe out there. And if you don't remember anything else, let's just love life to the fullest and live your best life. And hopefully that best life is to live life organically. It's organically, David. Let's be organic.